Retirement is when most of us finally get to tick off the bucket list. Safari in Kenya, a river cruise through Europe, flying over to visit the grandkids. But New Zealand is literally at the bottom of the world, and getting anywhere meaningful takes a long time in the air.
Long-haul travel gets harder on your body as you age, and being unprepared can turn the trip of a lifetime into a really uncomfortable experience. So, what do you need to know before you book those flights?
I'm Hannah McQueen, and this is The Next Bit.
And I'm Mark Leishman, and today we're joined by Dr. Andrew Nelson. He's a GP and travel medicine specialist at Worldwise Travellers Health in Auckland. Now, Andrew sees people every week who are heading off on big adventures, and he makes sure they come home safely.
Thank you for joining us. Let's start at the beginning. You're in your 60s, you're a couple, you're wanting to take a huge trip, maybe the trip of your lifetime. What are the things that you should be thinking about?
Okay. Well, before we start, let's just have a scenario couple. Husband and wife, mid-60s. Husband has a heart condition. Wife, unfortunately, had surgery, required, let's say, hip surgery, which required a month of rehabilitation in hospital. And so each person has their own specific medical issues. Now, if they're going on this trip of a lifetime, travel is extremely physically and mentally taxing, more so than you might realize until you're at the other end, jet-lagged and bickering, and just generally things can seem...
Sounds like a normal holiday so far.
Well, let's look at it from a pre-travel, during travel, and post-travel.
Yeah, what should we do before we get on the plane?
Sure. Plan. Do the husband and wife in this scenario have particular medication they need to take? He might have, or he probably will have, various cardiac drugs. Does he need to take them at certain times?
So we're planning just to understand our medications? Is that what we're planning for?
Well, that's one part of it. You need to know the medications you're taking and aspects around that. Are medications allowed into the other country?
Mm-hmm. Is that a thing?
Yes. Some countries...
That Coke habit, you're going to have to give up.
For example, medications that are controlled drugs. Say if somebody has really, really bad pain and they're needing opioids, that is a major. If somebody at the other end of the spectrum, say I've had a few, believe it or not, I've had a few patients in their 60s with ADHD.
I believe it.
And they are on medication that is actually a stimulant, so you need a letter from your GP explaining what medications you're on. And if somebody has chronic conditions, like a bad heart or something like that, then having something that has a bit of their medical background is always a very good idea. In case, worst case scenario, somebody got sick at the other end, you're giving the doctors a heads up. And if you're trying to translate, I have a bad heart into Spanish, it could be a bit tricky.
Yeah.
Do you have that situation where people turn up at the immigration or the customs, whatever, and they say, "What are these drugs?" Does that happen?
It does happen. It does happen. Because
unwittingly, they're perfectly safe drugs here in New Zealand, but regarded as
were they
stimulants.
though, Mark? Were they?
Any medication that is not in a bottle with your name on it, for example, automatically a bit suspect. Go to Bali, and they're very hot on what is this, what is that, and they will often not allow something in. And so if you're stuck at the other end without your medication, what do you do? So that's, medication is just one part of it. Chronic conditions. A lot of conditions airlines get very twitchy about. So does the man with the bad heart, is it so bad that he needs supplemental oxygen? Is it something where the lady in the scenario who's just had surgery, has she been signed off as fit for travel by her specialist? Because airlines, they really do not like having to turn the plane round midair because it'll cost them $300,000. So they're very keen to make sure that someone is fit to fly. And for New Zealand, for example, that is called a MEDA, M-E-D-A, medical clearance. You go to your GP. GP helps to fill it out with you and explain that, yes, probably need to get this cleared or that cleared. They take it to they send it to the Air New Zealand medical team, who can say yay or nay. And it's part of it is courtesy, part of it is making sure that there's no issues at the other end, or part of it is actually not being denied the chance to fly when you're at the gate.
Wouldn't that be so annoying?
So that situation, I imagine, is it relatively common where people turn up and will sit for a flight and suddenly they say, well...
It certainly can happen. Yeah. I know that there's about half a dozen docs at the Air New Zealand medical team, and they're quite busy with this sort of thing.
Wow. Didn't even know they had a medical team. Yeah. Okay, so we're preparing for travel. In your sort of depressing scenario, everyone's got a comorbidity. I was thinking we were in our early 60s, we're off to Europe, definitely not Bali, and we just want to know that we're doing it with our eyes wide open.
Sure.
So if we're on medications, you're saying, look, we've got to have those cleared.
Yep.
Ideally, you take a letter from your GP in case you're dealing with someone who doesn't understand things or customs. Anything else we should be anticipating? I guess the travel itself is going to be...
The travel itself. Let's talk about that. So, man has a cousin who's very fit and healthy, also in his mid-60s, maybe there's a history of a blood clot that he's had earlier on, or maybe he's just worried about them. Yeah. The physically taxing side of travel. Now, long-haul travel, everyone always thinks airplanes, but it's not just airplanes. So it's any travel over 4 hours without a break. So long-haul bus trips, lots of those, for example, in South America. Trains, that sort of thing. And so the risk of a blood clot, deep vein thrombosis, DVT, for example, increases the longer...
With age or...
With age is part of it. With comorbidities, your medical history is part of it, but also with the physical travel itself.
And just sitting,
because, Mark, where you're sitting there, because of gravity, blood's pooling in your calves, right? It gets to your heart eventually, but you've got more pressure in your calves. And so if you were sat in that chair for 8 hours or something like that, then when it's pooling, not only is it swelling in the legs, but it's also a risk of causing a clot in those big veins in the legs. And if that dislodges, it goes to the heart, brain, other organs, anything like that. So that's why it can be very dangerous. Wow. So things like keeping well hydrated, keeping a bit of exercise. So getting up on the plane every hour, every couple of hours, going for a bit of a walk. Yeah. Or if that's really difficult, you can't do that. Even something as simple as moving your ankles up and down. You can't see it, but this is...
He is moving his ankles up and down at the moment. Still, like you would on an accelerator on a car type.
Like you would, just sort of pumping that a bit.
Gosh,
Even that, it's using your calves.
I'm doing it.
And it's helping to push the blood back up to your heart.
Okay. Yeah.
These are very small things.
Yeah.
Medication that you might take on a plane to help you sleep can, unfortunately, lead to an increased risk of a DVT, because if you're zonked out on an airplane, you're not getting up to do this movement or anything like that. So you just sat there in that position. You can have an increased risk of a DVT.
Do drugs react? Do drugs react differently at high altitudes?
Well,
and if you're older, from those two perspectives,
an airplane cabin is pressurized to about 6,000 to 8,000 feet, about 2,500 meters. Now,
what does that even mean?
That means that you're at the threshold of what we call high altitude.
Right.
When you get to high altitude, the air is thinner, less oxygen coming into your body, and the greater the risk of the effects of hypoxia, that sort of thing. One of the things, alcohol hits you a lot harder. So people can get really quite affected. If you're mixing that with medication to help you sleep, or to calm you down if you're afraid of flying, Zopiclone, diazepam, something like that, that can have a real bad impact. So being very careful is a good idea. In terms of the physiology, how these things affect the actual body, that man with the heart condition probably has a propensity to, the blood's not quite flowing around the body, going where it needs to go as best it should. So it's already under strain. You put the strain of less oxygen going in, that's going to have another impact on the heart. So
the heart's having to work harder.
Heart is having to work harder.
So you're saying if you've got these conditions, you shouldn't travel?
No, I'm saying that you just need to, if in doubt,
precautions.
But take precautions. If in doubt, talk to a doctor. Talk to your GP. They know you best.
And don't drink on the flight.
Unless you want to.
Be careful.
Drink water.
Drinking plenty of water.
Yeah.
I'm not above saying, you can have a few drinks, something stronger on a plane, but just remember that it will hit you harder than if you were just at a dinner on a.
That's why my husband does drink on a plane. Yeah.
I enjoy a drink on the
Yeah,
plane.
it's knocked you
part of the. I feel once I sit in the aeroplane chair, I'm ready. Have a nice beer or something, and
Exactly.
I'm ready to go.
One of the other things that, sorry, just one more thing.
No.
One of the other things that happens when you're at altitude, for example, how food, a lot of people always complain about airline food.
Yes.
2 reasons. They're used to their home cooking, for one.
Yeah.
But also, things just taste different because the sensory signals from olfactory nerves in the nose that also do taste, as well as nerves on the tongue that do your taste, they are affected differently.
Really?
So they don't taste as...
Doesn't taste as good?
It doesn't taste as good. Tastes rather bland. Not as, you don't have that kind of... Maybe my dad used to put a lot of salt on his food. And so that is one of the many things that can affect you. But that's by the by.
Should we be taking vaccines before we go?
Depends on where you're going. Depends on who you are. So travel medicine consults. I always start by finding out who's in front of me, their medical history, where they're going, where they're staying, what specifics of the itinerary. Are they doing something fun like, are they going up to Machu Picchu?
Yep.
Are they going into the Amazon? Are they going down the Zambezi River? Something like that, because that very much affects what vaccinations you're going to need. A lot of places looking at vaccinations against gastrointestinal illness like hepatitis A, maybe typhoid. Once again, it depends on where you're going.
So you'd get the vaccine. Normally it's a few weeks before you go,
At least a couple. These vaccines, they usually take about 10 to 14 days for your immunity to reach a certain level.
Right.
Rabies is a big exception. We'll talk about that. We can talk about that later. But most of these vaccinations, you get the vaccine a couple of weeks before you travel, and you're good to go.
Let's get back to the rabid dog. I mean, is that really still factor internationally? Rabies?
Very much. Yeah. Kills 60,000 people every year.
Really?
Yeah.
Rabies.
It does. But once again, it depends on where you're going and what you're doing.
So you're in Bali and you get bitten by...
That's a friendly dog, so it's fine.
Well, is it?
No, it's not.
Rabies. Rabies, very, very dangerous. Present throughout Asia, Eastern Europe, Africa, Central America, South America. And if you develop symptoms, virtually 100% fatal.
My brother-in-law went to Africa on a safari, and he woke up one morning, this is like in the last year, and there was something pulling his hand, his finger.
Yep.
It was a rat
In
Africa. So I'm like,
oh my God.
what did you do? Like that's, he had all his vaccines, but...
Was he actually bitten? Or
it was bitten and tugged. He couldn't kind of get rid of it. Gross.
Well, that's another thing. Rabies pre-treatment series, pre-exposure treatment, takes several vaccinations over several weeks. 2 weeks after that, you have what I call pre-immunity, meaning that from that point on, if you get an exposure, then you still need some treatment, but it's a lot easier. 2 boosters, 3 days apart, starting within a week of that exposure. So it's it can be a very good idea for people if they're going to be in higher risk situations, higher risk environments, that sort of thing. Say, for example, if you had potential exposure when you're on a safari, that's the safari done.
But generally, is it countries like Southeast Asia, Bali, or Africa, South America, rather than your US? And
yeah, you'd have to be extremely unlucky and be bitten by a raccoon in the US.
Yeah,
does happen, but very unlikely.
So stay out of Africa. Don't go to the Amazon.
They're lovely places to visit. Just have to be careful.
Yeah, be prepared. And I mean, that's obviously those sorts of scenarios. But getting on the plane, I mean, talking about getting back to the medication side of things. I mean, is the letter from the doctor the best advice?
Yes. Having that letter from the doctor with your medications, with your medical conditions,
right,
extremely useful. So for for Customs and Immigration at the far end, but also for the clinicians at the other end if something was to happen. Because events-wise, people always think, oh, I don't want to get some dreaded barley belly or something like that when you're overseas. But by far, the more common thing is to be involved in an accident, or some other medical event.
Fall off a
scooter,
moped or something.
Yep. Slip in the shower, have a heart attack, something like that.
Yeah.
These sorts of things. So, if you're at increased risk, being prepared is the main thing.
Yeah. I mean, it's interesting, isn't it? Because you think of travel and you think, oh, it's going to be fun. We'll have the beautiful
just go to Europe and stay close to a hospital. Like, there is a workaround with this.
In Europe, there are a lot of...
Wait.
No, this is good. In Europe, you have fewer of the risky illnesses. And also, a lot of countries have reciprocal agreements with New Zealand or extremely good social healthcare systems, like in France, for example. So there certainly are fewer worries, but you still have to have the basic information with you and the basic sort of considerations for, say, for example, safety and security.
And you'd be suggesting travel insurance as well?
Oh, yes. Okay. Travel insurance is always extremely important.
Okay.
It's for that worst case scenario thing. Getting a good travel insurance policy and double checking the medical evacuation or medical treatment aspects of it, and taking a physical copy of the policy with you.
So I suppose you've got to take into account that if you're on a flight and something happens, you have an event, a medical event,
yes,
and they have to make a decision whereby they have to go to another airport or turn around. I mean, is that at your cost, or what generally happens in that scenario? I couldn't speak for Air New Zealand on that, but there is a risk that that you could carry at least some of the cost. Say, for example, if you had a condition that you didn't declare, right,
and they didn't know about it, and then you had this emergency on the plane, that can very much work against you.
Okay. So we're hopping on the plane. Let's say we've got arthritis.
Yes.
Or we've got spinal issues or something where actually the sitting down for a long period of time is very uncomfortable for us. Notwithstanding, we're going to get a deep vein thrombosis or whatever the case is. So for those people who want this trip, and I want them to have this trip, what do they need to do?
What do they need to do? Well, maybe getting the seat with the extra legroom.
So we're going business class to Europe. I like this advice with a good quality travel insurance.
Or on the aisle, so it's easier to stretch. Other things you could do, for example, if somebody has arthritis of the neck, those big neck pillows.
Are they good for you? I think they, firstly, look ridiculous, and secondly, can't.
But who cares what you look like on an airplane in the middle of the night at 40,000 feet?
Not everyone.
Only at 8,000 pressure, though, so let's not overstate
I swear by those.
Do you really?
I totally do. Absolutely.
But are
and
they actually
eye patches.
functional?
Yes.
This is what.
No,
slightly...
I do the neck things. The eye patches I find uncomfortable. My wife loves them.
Yeah.
So it's, it depends on what is comfortable for you.
Yes.
And so, of course, I can't say you must get this brand or anything like that. But that compression stockings are also a very good thing.
Okay, yeah.
So compression stockings that are fitted for you.
Oh, so you can't just buy them from farmers?
You can, but maybe ones that are in a pharmacy where the pharmacists are trained on how to fit them properly, because there are different ones for different foot sizes, different calf sizes.
Okay. Yes.
They need to have a certain amount of pressure that they can sort of gently squeeze the calves because what you're doing is just reducing that chance of
Expansion.
Pulling blood down in there.
Exactly, the pooling of the blood. Whereas a pair of long socks isn't going to cover it, but a proper medical grade compression stocking.
When should you put them on? My mum puts them on way too early, I think. We're at home and she's whipping them on before we even got to the airport, certainly not on the aeroplane. Mm-hmm. Is that normal, or is that...
I mean, it depends. If somebody...
Questionable.
If it's easier for you to put them on at home where there's a bit more space and you've got your system on how you're going to put them on, do it there.
What about if you have hearing loss or... the pressure in the ears can be it can be painful on the best of days,
Yes.
but...
Or if you've got a cold even.
Or if yes.
You can rupture an eardrum.
Yeah.
But if you're older or you do have hearing issues, is there a greater risk of something? And then if so, what could we do about it? Because we're still going to Europe, remember?
If you have hearing aids, making sure they're well charged, definitely, so you can hear the various announcements. But in terms of propensity towards getting something wrong, like the biggest ones would be if you get chronic sinus problems. That's a bit of an issue. So infections up here, causing swelling, causing problems with drainage from the ears.
Hence the cold scenario.
Hence the cold scenario. Pilots, I get a lot of pilots coming in who are grounded because they, temporarily, while they've got a bad sinusitis.
God, you don't want your pilot to be sick.
Exactly. It can be really quite dangerous. Yeah. But for our travellers, as long as they're relatively fit and well, and they're if they have a bit of a head cold, then they're taking medication to try to alleviate that. Mm-hmm. Whether they can take an anti-inflammatory, some people can't, or whether they take some nasal spray to help clear the head, something like that.
So there is medication that can stop that, because it's a dreadful pain.
The risks. Yeah.
Okay.
Because what you're
when
trying
you're
to do
going
is,
up, and
yeah, and then there's the classic things like why they give the sweets out when you're descending.
Yes.
So because it's helping to open up the eustachian tubes from the middle ear and helping to equalize the pressure in your ears.
Oh, Isaac, fantastic. So what actually does happen to our bodies when we're up at 35 to 40,000 feet?
Okay, so
bullet point. I can feel this getting deep.
Yeah. My wife is an anesthetic registrar, and she could talk about this for an hour.
Oh, gosh.
But bullet point: you go up, fluid shifts around the body, so you get the fluid going into the legs, for example. You get the slight changes to your physiology for the taste. You get some people who are already under physiologic strain, like heart problems, they a bit more at risk because of that slight sort of reduction in oxygen.
Yes.
But it's a little bit like altitude sickness for some people, but not as severe.
Yes.
And if you're prepared and you have the things like the stockings, etc., then you can. I'm not saying never travel. I'm just saying there are some things that you must do, that you should do to reduce the risk at the other end.
It's interesting, isn't it? It's like the jet pilot in the Air Force, whatever, who wears a G suit, which when it goes up.
So you're going to say G string? Oh my gosh, where
It's
are you
probably got that
taking
on
us?
as well, quite frankly. But to keep the blood all in one place, really. Almost like, and that's what a compression stocking does too.
In a sense, absolutely.
Okay, so let's assume we've declared our comorbidities, we've gotten through the flight, we've done the exercise, compression stocking, his crazy pillow, and all those things. We're at the other end.
Yes.
We're jet lagged. We're excited, but we're jet lagged. what's your best strategy for an older person to bounce back from jet lag?
I like melatonin. Melatonin is a hormone that's produced by the brain, and it governs your circadian rhythm, your sleep-wake cycle. And so...
On the plane, you're saying we take this?
I'm certainly at the other end. You can, if you find it helps with your sleep, you can take it before you, as you're on the plane. But
does it make you drowsy?
It makes you drowsy. Right. It can do. So there are maybe other medications that could help with that. But for the jet lag at the other end, a course of melatonin may be a week there and a week back.
So are you saying when we land and it's 7 o'clock in the morning, our bodies, in New Zealand, it would be 7 p.m.
Yep.
So we're popping a pill then?
No, it's best if you can push on through.
Okay, so we push on through walking around the city.
Plenty of light. So 7 a.m.
The sun.
Stay out of the darkened cathedral, but out into the lovely lit town square. It's that UV light helping to trigger that adjustment to your new time your new time zone. And then melatonin, 1 tablet an hour before your intended bedtime, if you can. But of course, that's a big ask, that 12-hour change. So this is it's not going to be a miracle cure, but it's going to help reduce the amount of time that your body needs to adjust to that new time zone. So it might be a few days as opposed to a whole week.
Sorry, Mark.
I was just going to say that age-old question of what do you do when you've done a long-haul flight? Is it best to just, if you feel tired, go to sleep, or is it best to stay up?
You're pushing through.
And
You're pushing through in the sun.
Yeah. If you can push through, fantastic. But if you get there and at its middle of the night, maybe that's when you might take that melatonin and try to go to sleep then.
Yeah, I went to London last year and arrived at 6 o'clock in the morning. I had a wall. I tried to stay up. Everyone's like, stay up at like 1 o'clock. I was a zombie. I couldn't stay up any longer, and I was in charge of my daughter, so I had to be responsible.
She was fine.
she was fine. But I imagine, does it hit you harder as you get older?
It could certainly feel like it, because people as they get older, their circadian rhythms, that sleep-wake cycle, can be a bit out of tune anyway.
Yes,
people find that they think their sleep patterns are poor because they're always waking up at, say, 4 in the morning. But if you're going to bed at 9 and wake up at 4, you're still getting quite a lot of sleep. And so it certainly, that adjustment to a new time zone can be particularly difficult as you are older, because it's physically and mentally taxing.
Accidents, we'll move on from the drug side of things, the accident side of things, which is the other big issue. Are there any things that you would suggest people should pack into their luggage prevention of accidents, or is it something you can't really?
Prevention of various things. My boss had a very good point a few weeks ago. We're taking something like, if somebody has mobility issues or balance issues and they're of a certain age, then something like one of those roll-out plastic bath mats that, the little suction cups underneath.
Oh, yeah.
Something like that. It's nice and lightweight. If you can put that in your bag and just put that in the shower at the hotel at the other end,
I see.
Just reducing that risk of a fall, which could be pretty disastrous. Other things to take with you. This is more on the security side of things as opposed to accidents, but doorstop, plastic doorstop. If you're staying in a hotel that, let's say you're a bit more adventurous and you're not staying in the nice, beautiful 4-star Radisson.
Yeah.
But you're staying in
backpackers.
Local accommodation, Airbnbs, something like that. A doorstop doesn't weigh very much, doesn't cost very much, and it's an easy enough thing to just wedge it under the door when you're going to bed. So
as an extra security lock.
Someone's trying to, if they're trying various rooms in the hotel, they'll probably move on from yours and try the one that's easier to get into.
Isn't the door locked? Like, I'm confused.
Potentially, but potentially not.
I stayed in a little hotel is being generous in the Piraeus in Athens.
Oh gosh!
And the lock was a little latch, sliding door with a little latch. So I stayed in there for one night and moved out the next day.
Yeah. What about eating and drinking in unfamiliar places?
Eating and drinking, very big topic. Okay. So safe eating and drinking. Mm-hmm. If in doubt, don't trust the tap water. And for drinking, cooking, cleaning, washing your face, washing your hands, and brushing your teeth, you need safe water, which generally means boiled or bottled.
Can you rely on bottled?
If it's bottled water that you take off the security seal yourself, it is more likely to be safe, but there are scams out there where people have drilled a hole in the bottom of the bottle, for example, to refill it. If in doubt, boiling your water. If you've got access to a kettle, a good rolling boil will kill anything there. And say you would do on any farm in New Zealand, you boil your water, you boil your water overnight, use it throughout the rest of the day.
Good.
And then getting into those COVID habits, taking some hand sanitizer with you is always a good idea. And then when it comes to food, a good mantra to live by: cook it, peel it, boil it, or avoid it. So if you're this couple that's on this dream holiday and you're trying to figure out what to have on the menu, stay away from that thing that on the buffet that you're not sure how long it's been there. But if they're cooking something fresh for you, it's more likely to be safer.
What about places like India? Street food in India, would you? You
wouldn't.
If it's cooked, is it all right, or
no,
just avoid it?
You don't even know what it is. Let's be honest.
There has to be an element of judgment and personal responsibility. So, if you're going into a restaurant and everything looks clean and tidy, or if you're on a tour, organized tour, and the tour guides are taking you to these places, then more than likely it's
I don't know if that's
reliable.
true, because when I was in Egypt, I was on a tour and I was having the food like a lettuce or something, but the food is washed with the tap water. And I didn't even, I was so careful, and I just had a little bit of lettuce and then good night, nurse.
Oh, God.
I was just like, oh my gosh.
Well, that was a good pickup. This fact that you saw them sort of washing it with tap water, that's perhaps not as reliable.
Yeah.
Definitely.
Yeah.
So don't have salads.
No salads.
But, well, that's tricky.
Time.
Everyone says always avoid, go vegetarian or whatever, but avoidance is tricky. You want to experience the local food. You want to experience the local culture. So just staying in the hotel and eating Western food all the time is not a holiday. And so it's about playing these risks in your mind.
Okay, and if something was to go wrong, what is the 1, 2, 3 that we should do? What's the order of actions we should take if we had a health accident or a medication mishap?
If you're on an organized tour, easy. The first thing to do is tell your guide. Okay. Absolutely. Tell your guide, say you're sick, say, so they can keep an eye on you. They could, if they think that you're bad enough, or if their policy is, right, send you to a clinic, they'll have a clinic lined up they can take you to. If you're there independently and you're feeling unwell, get it seen to early. If you've got a fever and you're in a place that some places are more at risk of mosquito-borne illnesses than others, you treat a fever early and before it can get out of hand.
So that means going to the doctor?
It means going to the doctor. It means going to a clinic or the hospital. In Vietnam, for example, a lot of things are done out of the hospital. In Bali, there are clinics that cater for Western tourists, but they charge an arm and a leg. So that's why having this insurance is an extremely good idea.
Mm-hmm.
I mean, it is challenging, isn't it?
Yeah.
Even getting to the airport, getting through security, getting on the plane, the other end getting through immigration, and then getting to your hotel or wherever. I mean, it's not for the faint-hearted, really.
It's not. It's fantastic, and Kiwis love to travel.
Yes.
Kiwis love to fly. But as you no doubt would have seen by now, there is no easy fix for these things. There is a series of safety nets and advice. And if in doubt, get it seen too early. Or if in doubt, if you have kit for traveler's diarrhea, don't be afraid to use it.
This has been really interesting. Let's just repeat back what we've learned to see if we have paid attention, Mark. We're going to visit the GP.
Get GP first up. You're going to declare all your medication and get some sort of certificate or letter outlining what you take, so that when you go to your foreign destination, you can show that and say, this is not illegal drugs. I'm not a big dope dealer. This is for me.
Yes.
To keep me safe.
And get the vaccines sorted.
Talk to a specialist about what vaccinations might be a good idea.
Okay, so that's to a travel doctor.
Can you rely on your own doctor, or do you need to go to a specialist?
If your doctor feels uncomfortable, they can refer you to a specialist.
Or if they're Googling.
Yeah.
Like,
a lot of things that
exactly. So, and you're not the doctor, and nor am I. So we want someone who's not going to Google to tell us.
Certain medications, certain vaccinations absolutely have to come to a specialist.
Yes.
Yellow fever. That's the only one. Well, there are very few that are compulsory. That would be one of them. But other ones that are rabies, some GPs are pretty good at that. Certainly hepatitis A, typhoid, tetanus, that sort of thing. A lot of GPs are very good at that. But if they're at all unsure, either they talk to us or they ask you to talk to us.
If you're relatively fit and well and heading overseas, what are the top 3 vaccines we should take?
Hepatitis A is very useful. It's a disease that's worldwide, spread through infected food, infected water. That's one. Making sure you're up to date with your tetanus, always very good idea. Tetanus is everywhere. And measles is very much on the rise. So if you have never had the full course of the measles vaccinations, or if you're at risk, going to a risky area, measles.
What is the most important thing to ask your GP before you leave?
What medications, or what do I need to do about my medications, and what do I need to do about my chronic conditions?
What are the biggest dangers for older travellers?
Accidents, safety and security would be the big things. Making sure that you reduce the risk of basically accidents, and taking something like a fake wallet with you, because you will stand out. So if you were to be seen as a target, right, here it is. No fight, no fuss. They're happy.
That whole thing of don't act like a tourist.
Don't act like a tourist.
Yeah, try and feel like a local, if you can.
It's impossible, but it's worth a try.
Yeah. How can you avoid the likes of barley belly or deli belly?
A gastro kit from a GP is a very good idea. Gastro kits are named for medication for it. Loperamide to slow down the gut, electrolyte sachets, and for persistent issues, something like azithromycin antibiotics.
And then if you do get it, go straight to the doctor.
If you do get it and you're not able to sort it yourself, go to a doctor. Absolutely.
What should you do to make a long-haul flight more comfortable?
Try to give yourself the best chance of being able to sleep, whether that's more leg room, better moving around the cabin, things like a neck pillow, things like the compression stockings, plenty of fluids, patches, that sort of thing.
And I do believe that probably you are best to be on the row seat in a jet, because it means it's easier for you to get up and go for a walk, isn't it?
Certainly me. 6'4". The aisle seats is the best way.
Yeah. And how can you keep yourself safe from muggers or those who mean you harm?
The fake wallet, keeping any valuables hidden if you have to take any at all. A fake wallet is something you don't mind losing. Some old cards, some low-value local currency or US dollars. So if you get robbed, right, here it is. No fight, no fuss. They're happy, you walk away. Travel is a wonderful thing, and part of my job is to always talk about the worst-case scenario, so it can seem like I'm scaring people on purpose, but it's not. It's just making sure people are aware of some of the risks. I spent 8 weeks in Tanzania. It is a wonderful place. I have had many of these, let's call them weird and wonderful countries on my bucket list, and I'm slowly getting through them. But the aim is that's the whole point of life, is experience. And so seeing these places, enjoying these things, and it's just being prepared.
Well done. Andy, what a lovely way to finish. Thank you so much for that. It's been really illuminating.
Oh, thank you.
And
Thank you.
Appreciate your time.
Retirement travel should be one of the best chapters of your life, and it absolutely can be if you go prepared.
Give yourself the best chance of having a great trip and not spending day 3 of your dream holiday looking for a pharmacy, a doctor, or even a handrail.
Exactly. Now at Brightly, we talk a lot about staying independent and well for longer, and this is part of that experience. It's not just about being fit enough to travel, it's about being prepared enough to enjoy the travel. Visit agebrightly.co.nz for more info.
And if you know someone who's about to head off on a big trip, send them this episode. It just might save them a whole lot of hassle.
Thank you for listening to The Next Bit. We will see you next time.